Having failed to offer anything resembling an alternative to the healthcare law and clearly befuddled by the Supreme Court's decision, Mitt Romney once again sought refuge in the halls of one of his favourite American institutions.
Businesses across the country have been asked what the impact is of Obamacare. 3/4 of those surveyed by the Chamber of Commerce said Obamacare makes it less likely for them to hire people.
That's not something Romney said just yesterday. Oh no, it's something he says virtually every day.
I saw a survey the other day that was done by the Chamber of Commerce. Chamber of Commerce. About a year ago, the Chamber of Commerce did a survey of some 1,500 small businesses. 75% said Obamacare made it less likely for them to hire people.
Robert Reich is Professor of Economics at UC Berkeley and served as Labour Secretary under President Clinton. Good afternoon, sir. He's also the author of Beyond Outrage, What Has Gone Wrong with Our Economy and Our Democracy and How to Fix It. Professor Reich, the Chamber of Commerce, which has spent a lot of money running ads against the healthcare law, issued a press release admitting that the survey Romney cites in virtually every speech is not a representative scientific sample of small business executives. So why does he keep using it to make his case that the law is, and I'm quoting him, a job killer?
Because the media keeps reporting it, Martin. I mean, look, Romney will say anything as long as the media will say that he said it. He'll make up facts. He'll tell big lies. And in this election, I mean, in every election, you have candidates who are not necessarily punctilious about precisely what they say and the sources of everything they say. But in this election, this particular candidate, Mitt Romney, seems to be breaking all records for saying things that have no basis in fact, for making up facts, and for leaving out any reasonable details of any proposal that he's making.
Indeed, we refer to him as Mitt the Mendacious. Romney also claims the law will cost, and I'm quoting him, trillions in new deficits and debt, and will mean 20 million Americans will actually lose the insurance they have. Now, are any of these claims true? And do you have any idea where Romney's getting his information from?
First of all, none of the claims is true. I have no idea where Mitt Romney is getting his information from, except perhaps from people who support Mitt Romney. Maybe he is making it up on the basis of facts that are supplied by Republican think tanks that are making up the facts. I don't know where the facts are coming from, but there's no doubt in my mind at all, Martin, that we are going to see over the next 4 months a deluge of big lies told about the Affordable Care Act. I mean, it's sitting right there. People have not experienced much of it. Most of it goes into effect in 2013, 2014. And many people are quite nervous, naturally, about their jobs, their wages, their health care. People who have health care, even though their health care will not in any way be affected by the Affordable Care Act, they are sitting ducks for demagogues who will essentially come along and make them fear that they're going to lose something rather than gain something. Here's the fact. The fact is that right now we have 30, 40, 50 million people in America who are not in any way insured for health care. They therefore do not see doctors to prevent their health problems from becoming catastrophic problems that eventually have to be dealt with in emergency rooms, which you and I and everybody else pay for. That is a huge expense to this economy. That's one of the reasons, there are others, why health care is now 18% of our national product. I mean, no country has as large a healthcare budget as we do, with as many people and as large a percentage of the population going without any health insurance.
Romney says that he'll repeal Obamacare and replace it with some of these key provisions. Watch this, sir.
We have to make sure that people who want to keep their current insurance will be able to do so. Got to make sure that those people who have pre-existing conditions know that they will be able to be insured. And something that Obamacare does not do that must be done in real reform is helping lower the cost of health care and health insurance.
Professor Reich, he's just ticked off 3 critical aspects of the health care law that's just been upheld by the Supreme Court. Does this man even know what's in this law?
Yeah, well, he must know what's in the law, because the law is very much modeled after the law that he passed and signed into legislation in Massachusetts when he was governor there, that might be called Romney Care. I mean, it's very awkward for Governor Romney to say with a straight face that Obamacare does not deal with pre-existing conditions, when he must know that that's one of the cornerstones of Obamacare. It's telling insurance companies you've got to take people who are sick, even though you may want to avoid them. Right now, under the law, many insurance companies can avoid sick people. Once Obamacare and once effectively the Affordable Care Act, it's called Obamacare even in the White House now, goes into effect, those people and those insurance companies will have to take sick people. They'll also have to do a lot of other things they don't want to do. In Massachusetts, right now, under Romney Care,
yes.
You might as well call it Obamacare. They're both together, but they're basically the same thing. A lot of doctors, hospitals, insurance companies have got to do many of the things that they nationally will have to do under the Affordable Care Act.
Indeed. Professor Robert Reich, thanks so much for your truth-telling on this subject.